Welcome to Frederick at its best. I'm Frederick County Executive Jan Gardner, and I want to thank all of you for joining us today to celebrate National Public Health Week, which is designated as the week of April 1st to April 7th. National Public Health Week is a time to recognize the contributions of public health to our well-being and to highlight issues that are important to improving our health in our nation and our community. The mission of the Frederick County Health Department is to improve the health and well-being of the residents of Frederick County through programs to prevent disease and illness, promote wellness and safety, and to protect public health. The Health Department is making a difference. We just learned today that Frederick County ranks third best in the state for overall health outcomes, and that certainly reflects well on our Frederick County Health Department, as well as all of their partners and our effective collaboration to make sure that our community lives well and is healthy. The employees of the Health Department treat their customers, clients, partners, and those they serve with respect by listening to them, understanding, and responding to needs. As a nationally accredited health department, there are numerous notable achievements to share. Some of the recent achievements include receiving the 2017 National Exemplary Award for Innovative Substance Abuse Prevention Programs, Practices, and Policies for the Kids Like Us program for children impacted by substance misuse, and that means they live in a household with substance misuse. Training or retraining of 1,400 individuals in overdose response to administer naloxone, also known as Narcan. And Narcan is a medication that reverses the effect of overdoses, and it does save lives. Additional accomplishments include starting the Childhood Lead and Asthma program and accepting the first clients into that program in March of 2018. Introducing the Maryland WIC mobile app to our county participants with over 1,700 Maryland WIC mobile app users in Frederick County. Inspecting 586 swimming pools by the Environmental Health Services, something a lot of people wouldn't think that the health department's responsible for doing. Increasing membership in the Safe Kids Coalition by 30%. Implementing video direct observed therapy for tuberculosis clients. Launching the Maternal and Child Health #SafeToSleep campaign to bring awareness to sudden infant death syndrome and to promote safe sleeping habits for babies. Attending to over 275,000 total school health office visits, and that's certainly a lot. So with 42,000 students in our school system, those students made 275,000 trips to the health room over 1 year. So sometimes we say kids are sick and carry lots of viruses with them, and that kind of proves that statistic to be true. The health department's also screened 492 women for breast and cervical cancer and 78 men and women for colorectal cancer. Now, the month of March is also Colorectal Cancer Awareness Month, a rallying point for the colon cancer community where thousands of patients, survivors, caregivers, and advocates throughout the county and the country join together to spread awareness about colorectal cancer. Part of Colorectal Cancer Awareness Month is the Do Not Assume campaign. For instance, do not assume that you are too young for colorectal cancer. Do not assume that you're alone. And don't assume we don't need your support to end this disease within our lifetime. The goal is to challenge these assumptions and misconceptions about colorectal cancer by dispelling myths, raising awareness, and connecting people with information and support. And of course, we encourage screening. When people stop assuming, they get screened, they reached out for support, and they pay attention to their symptoms and advocate for their own health. Screening is the #1 way to reduce the risk for this unique cancer. It's also important for all of us to take charge of our health by knowing family history, understanding risk factors, eating a balanced diet, exercising, limiting alcohol use, and never smoking. I truly value the professionalism and expertise of our local health department and their work to prevent cancer, disease and illnesses, promote wellness and safety, and protect public health. So I do have a proclamation to read, and then we'll introduce the people who have joined me up here today. Whereas the week of April 1 through 7, 2019 is National Public Health Week, this year's theme is for science, for action, for health, and whereas 7 in 10 deaths in the United States are related to preventable diseases such as obesity, diabetes, high blood pressure, heart disease, and cancer, and 75% of our healthcare dollars are spent treating such diseases. However, only a small percent, 3% of our healthcare dollars, go towards prevention. And whereas more than half of all cancer deaths could be prevented by making healthy choices like not smoking, maintaining a healthy weight, eating right, being active, and getting recommended screenings. And whereas education is a leading indicator of good health, giving people access to better jobs, incomes, and neighborhoods. Students that do not graduate from high school face lifelong health risks and high medical costs and are more likely to engage in risky behavior. So education is important to all of our health. And whereas strong public health systems are critical for sustaining and improving community health. So now, therefore, as the County Executive of Frederick County, Maryland, I hereby proclaim the week of April 1st through April 7th as National Public Health Week in Frederick County and commend this observance to all of our citizens. So with that, I'm going to pass the microphone and I'm going to start off with Dr. Brookmeyer.
Thank you very much for the proclamation. So National Public Health Week is a time to celebrate the power of prevention, to advocate for healthy and fair policies, and to share strategies for successful partnerships, all with, again, the aim of following through with the Frederick County Health Department's mission. So we were established in 1886, and the mission of the Frederick County Health Department is to improve the health and well-being of all residents of Frederick County through programs that prevent illness and disease, promote health and wellness and safety, and protect the public's health. So I encourage everybody to follow us on Twitter and Facebook this week, or actually April 1st through 7th, National Public Health Week, where you'll learn more about what we're doing in the community every day behind the scenes to help Frederick County be as healthy and well as possible. And I appreciate your support, County Executive Gardner, as well as all of our partners here. Our success for ranking third best overall in Maryland for counties is definitely due to the strong staff at the Frederick County Health Department and our partnerships and collaborations. Our ranking of third best overall, it does take into account clinical care, but we know that when we look at somebody's overall health and wellness, that only about 10% of it is related to the actual clinical care. The rest of it is related to social determinants of health, and that's what the county health rankings ranks every county in the United States at the same time using the same data source. And it takes into account other factors such as housing, education, and other social determinants of health that make a big difference in somebody's ability to be able to take full advantage of what's available.
Thank you, Dr. Brookmeyer. And once again, thank you to County Exec for today for this public awareness for this proclamation. I like what you just said. You said partnerships, you said power, you said promoting, and you said prevention. And together, that's what we can do as the public. I'm Angela Spencer with the Faith Striders, a local organization here where we are fighting against illnesses through him. And I'm so grateful that this month is Colorectal Awareness Month, which one thing that I've learned from my friend here, Beth Mowry with the health department, is that colorectal cancer, if we get screenings early enough and if we follow our symptoms and signs, that's something that we actually could prevent, a word that Dr. Brookmeyer just used. So in April, the Faith Striders, we're having our annual Survivor Breakfast, and this year we are acknowledging and promoting education referencing colorectal cancer and colorectal screening. Dr. Pierre will be our keynote speaker. We generally highlight breast cancer awareness and information with that, but I've met so many people over the past 2 years who have had tumors, who have had surgeries, who have had symptoms referencing colorectal cancer, and their doctors clearly said, had you had your screening, had you had your colonoscopy, this could have been avoided. So we want to promote, we want to prevent, we want to partner, and we want to let everyone know that you can get screenings, and the health department has that available. So thank you so very much.
Thanks, Angela. Good morning. Thank you, County Executive, for the opportunity to be here this morning. My name is Beth Mowry, and I'm the Program Administrator for our cancer screening programs. As County Executive mentioned, March is colorectal cancer awareness. We do have a program for colorectal cancer screening at the health department. So we really want to encourage our county residents age 50 and older to talk to your doctor or your provider about being screened. And if you have any questions about that whole process, or if you lack insurance and need our assistance, please give our health department a phone call or visit our website, and you can find further information on there. I also wanted to mention and build upon what Angela's saying in terms of how we in public health partner and collaborate. Heather Kirby is here from Frederick Regional Health System. She's going to be talking a little bit further about a recent steering committee that we formed looking at colorectal cancer screening across the entire community. And we have other partners involved with that as well, the Asian American Center, the Faith Striders. So that's a lot of what we do in public health, is identify where there's a need, reach out and work together and partner together to address issues of health throughout the entire community. So,
thank you very much, County Executive. My name is Emeka Munonye, CEO for Masters Specialty Pharmacy. I'm really glad to be here. At Masters, we are committed to the improvement of health and wellness in our community here, and we've been serving the Frederick County residents for about 3 years. We recognize that colorectal cancer is a problem in our midst. We recognize that the incidence rates and the mortality rates are even rising for minority communities. For me, we have a passion for serving the minority communities and the underserved, and it is to us a big challenge, and that's why we are partnering with the Frederick County Health Department. We are partnering with the Frederick Regional Healthcare Systems as we join the fight to create awareness and see how we can turn the trend of this problem. Thank you.
Hi, I'm Avnisha, Education and Outreach Coordinator for Cancer Screening Program at Frederick County Health Department. I'll just like to say, as everybody said, cancer screening saves lives. So make sure you and your family members are screened for colon cancer. And if you have any questions on how to get screened, you can call our program at 301-600-3362. Thank you.
Hi, I'm Heather Kirby, and I'm with Frederick Regional Health System. And as my colleagues here already pointed out, we have taken a very active role in the health of Frederick County. The health system believes very strongly that we have a role not only in taking care of folks and providing that clinical care that Dr. Brookmeyer mentioned, but also in increasing education and awareness and helping to advocate and promote prevention opportunities. So we've pulled together a steering committee. Several of the folks are here with us today, as well as Frederick Community Action Agency, a few of our local gastroenterology partners. We're really taking a look at, can we put together a comprehensive education program to raise awareness in the community about the importance of screening. And then, so what do you do once you've raised that awareness? The next step in that is helping to navigate folks to the screening process, on through diagnoses, et cetera. So I'm really excited to say we've been working to pull that together over the past 9 months. And in March, from March to June, we have about 14 community events planned to raise awareness and really start to educate the community on the importance of colorectal cancer and the screening that goes with that.
My name is Max Cole, and I'm with the Frederick National Laboratory for Cancer Research here in Frederick County. And I would also just echo all the sentiments made so far about the importance of prevention and screening. And I should also point out that we have a team of scientists that work at the National Laboratory who are focused specifically on RAS genes. And mutations in RAS genes are actually responsible for 45% of all colorectal cancers that are diagnosed. And so we have a team of scientists who are specifically looking at that problem and trying to find ways that we can come up with better treatments, better drugs that can help treat some of those cancers that are driven by the RAS genes. So just wanted to mention that we do have a team here locally who's working on that very important problem in cancer research.
Hello, I'm Lauren Perry. I work with Dr. Pierre's office, the MHP surgical specialist, and I am part of the colorectal cancer steering committee. We're very excited to be part of this process to be able to help our underserved community get screened. Thank you.
Well, thank you, Executive Gardner, for hosting this. My name is Miriam Dobson. I'm the Director of Community Health Services at the Frederick County Health Department. I've been a registered nurse for the last 32 years, and about a third of my career has been in public health, and I have found that to be by far the most rewarding facet of nursing that I've participated in, because we have the opportunity to work directly with the community before, during, and after a health incident, and I've had the proud opportunity to serve a very dynamic division that mirrors the diversity of the community, and I look forward to working with them to help improve the health and the lives of the Frederick County residents.
Hello, my name is Dea Dorsey, and I am a community health nurse at the Frederick County Health Department, and I would just like to be here to be thankful to promote National Public Health Week.
Hi, good morning. My name is Catherine DeGennaro. I work for the county in the Human Resources Division, and I administer our wellness initiatives. And with partners at the health department, we have put out Narcan training for employees, and we will continue to roll out additional programs like that this year. And also with regards to screening, with our partners at Cigna, we have communications that go out to employees as age appropriate for the various screenings that are available. Thank you.
Thank you. Thank you, County Secretary. My name is Elizabeth Chang. I'm the Executive Director for the Asian American Center, Frederick. Public health is really one of the focus in our agencies in terms of improving health equities and addressing health disparities. And we do that by several things every year, which is the health fair that some of you may know is in October 26th is coming this year, and also developing community health workers. And these are workers that from the communities and really becoming an important bridge, to our public health system. As Dr. Brookmeyer said, it is the social determinant of health. It's not just the absence of disease. Really, 90% of times that we have to look at insurance, looking at language, looking at transportation, and different factors affecting the health outcomes. We are proud to see that we are continuing to be a great partner to our hospital, to the health department, and really the extension of them, because as in our agencies, and I'm sure that Renata will talk about the language access, but right now at this time that I also want to point out, we are the MODA grantee, Minority Outreach and Technical Assistant, for the last 15 years with the state of Maryland, Maryland Health Department. So in April, which is Minority Health Month, again partnering with the hospital, with the health department, and also with YMCA, and we will be having a great health fair, kind of like information in particular to address the local health improvement plan. It is April 20th from 11 to 2 p.m., I'm sorry, that at the YMCA that we'll have Agnes, the health mobile, we have the hospital come and talk about a chronic disease, we have the health department with HIVs and also other services that you're bringing on board. So it is a great and also event, so please come out and join us and get more information. So again, as an agency, we're very proud to have that capacity to improve access to health care. And last but not least, it's really our prenatal, our program that we're the only one that provides Spanish-speaking baby showers, that we have 100% positive pregnancy outcome, which is really a joy to all of us. So I just want to say thank you again for today and the opportunity to share.
Hello, my name is Renata Shorta. I represent Asian American Center of Frederick. We're doing there a lot of programs. One of them, language resource services. We have 35 languages, so we serve our community really well. One of the programs that we are very big on is believing into prevention for expectant mothers. We teach them education and importance of nutrition, diet, and preventing any diseases while they are expecting, which in turn makes the babies healthy for the community. Thank you.
I'm Tim Nichols from Cigna, and at Cigna, our goal is to improve the health and well-being in the communities we serve. We've been a nationwide leader in reducing the opioid epidemic, and along with our partners here, we encourage everyone to get their age and gender-appropriate annual screenings and have a conversation with their doctor about how to improve both the body and mind. So we appreciate the partnerships here today and being in attendance. So thank you.
Thank you. I want to thank all of you for all that you do to promote public health, to serve our community. There really is a lot of passion here, a lot of energy, time, and commitment to what you do, and it really does make a difference in our community. So focusing on the health of Frederick County residents is good for everyone. We're all affected by public health issues, and we are all part of the solution to those problems. In addition to the programs at the health department, and you've heard them about other places as well, there is a local community organization called Live Well Frederick. And Live Well Frederick is a collaboration, a partnership between government, business, and other organizations to really improve the health of the people who live here. Frederick County government, the health department, Frederick Regional Health System, the Frederick County Chamber of Commerce, the Frederick County Public Libraries, Parks and Recreation, the Y, and the United Way are just a few of the partners of Live Well Frederick. Focusing on the health of Frederick County residents is good for everyone during National Public Health Week and all year long. I encourage all of our residents to join us on our journey to better health by eating better, being more active, and taking better care of themselves. A lot of people make resolutions at the first of the year to put themselves in better health. I'll say another opportunity to do that is with National Public Health Week. So challenge yourself to get active and eat better. For more information about Live Well Frederick, you can go to livewellfrederick.com for information. And for more information about health and wellness programs through the Frederick County Health Department, you can go to frederickcountymd.gov/health department. Thank you for joining us to celebrate National Public Health Week. Thank you to everyone in our community who works hard to make sure that we have a healthy community for everyone. Thank you for joining us for Frederick at its best.